Thank you all for joining us today. We're going to talk a little bit about all the issues municipalities are dealing with on their budget these days, from the pension plans to your OPEB, healthcare renewals, bond ratings, budget issues. So much fun. So thank you again for joining us. If you have questions along the way, drop them in the chat. I'll do my best to get to them as much as we can. And let's get rolling. So what are we going to talk about? Well, healthcare renewals, you guys have started to see those, and those are not pleasant generally. Budgets are tight. A lot of things going on in Medicare Advantage these days. Pension obligation bonds. S&P put out a new model in September of 24. That's not helpful for you, a lot of you guys. Uh, Employee classification. Are they teachers? Are they enterprise funds? Are they public safety? You have retirees who are beyond age 65 who remain on active plans. You've got people who come into your retirement system with prior service in another location. And again, this varies by state, so we'll talk about that. We have the migration of the private sector to the public sector plans. We have Medicare Part B reimbursement. We have what we call post-pension funding and some hybrid models. So we'll dive in. So healthcare renewals. We're seeing most groups right now are receiving double-digit healthcare renewals, 10, 20, 30%. I've even seen some at 40%. So again, the costs are high. The question comes up, why? There's a lot of reasons why. There's GLP-1s that you guys see, weight loss drugs. You've got cancer diagnoses among younger employees. You've got aging demographics. You've got issues about consolidation in the healthcare arena between hospitals are buying up physician practices and hospitals are buying up other hospitals. So there's not really that many hospital groups to negotiate with. And then during COVID, a lot of these providers were operating under older agreements where they were, lower inflation environment, and they all got beat during COVID, and now they want to make their money back. Add in that the delayed care during COVID, and here we are. We expect these higher rates to continue for the next 2, 3, maybe 4 years, and then hopefully it'll come back to a more moderate healthcare renewal. But we will see. The Medicare supplement plans are also coming in double digits these days, which is not helpful for those with OPEB plans. Medicare Part B, we're projecting about 11.6 after the government shutdown. We expect that number to get released soon, but that's about where we expect numbers to come in. And you have significant budgetary pressures. It's like a lot of you guys are seeing that the budgets were tight and only getting tighter, and now this comes on top of it. That's not helpful. Those of you with OPEB plans, and I realize not everybody has OPEB. This is other post-employment benefits, retiree medical. But for those of you in states where you offer it or in communities that do offer it, here's the things that go on here in a sample example. Your Medicare supplement plans are generally responsible for about 75 to 80% of your OPEB liabilities. That's a huge number. And so what that means is as your healthcare costs go up, your Medicare supplement costs go up. If they're going up by, say, 15%, we expected 5%, that's about a 7.5%, 8% loss on your OPEB, which is a big number. Now, again, some of you folks have a lot of early retirees, or you have, large number of retirees who remain on the active plan beyond age 65. Your Medicare share of the liability will be lower, but even then, it's still going to be a very big number. Now, here's the thing. Your active healthcare costs might have gone up by 20% this year, and you come to me and say, oh my God, we get killed on the actives. Now, here's the thing. For OPEB alone, the actives is not where the money is. So keep that in mind. It's still a very big number, still matters on your budget a lot, but it's not an OPEB issue so much. So the actual losses are going to also serve to increase future benefit payments, which ultimately will also lower your discount rate and therefore drive liabilities higher. It's really a twofer in a sense. The higher payments increase your long-term costs. The higher payments also lower your discount rate, which additionally raises your liability. So you really hit in two different directions. So your municipal budgets, many of you guys have seen your budgets are very, very tight. ARPA ended, state aid and federal aid now is flat to below inflation. You've got existing contracts you've already agreed to of 3-4% increases. For those of you in states, we do a lot of work in Massachusetts. Those of you there, they have this thing called Proposition 2.5, which means property taxes going up by more than 2.5% a year require an override on behalf of the residents. Those are very difficult to come by. Others of you in other states have referendums on your budgets. Again, you're trying to raise revenue. That can be difficult. And even in those where you don't have to get the voters' consent, you have elected officials, be they a city council or board of selectmen. The reality is they all want to get reelected. And so that's their version of voter consent. If they raise the taxes too much, they don't get reelected. So revenue's hard when the federal and state aid dries up. So layoffs or cuts in services have or will occur. And those of you who have OPEB plans, maybe you're funding $250,000 a year, $500,000, $1 million a year. That's an easy place to look when you go, I don't want to cut any more services. I'm not obligated under the law to fund my OPEB plan in an advanced nature pre-fund, if you will. So it's an easy place to go look for money. We don't want that to happen. There's a lot of reasons why I don't think that should happen. But also, as I always tell clients, I don't have to get elected. So it's easy for me to say, put more money in. So the sample budget impact, here's just the sample town we work with. Names have been changed to protect the innocent, but it's a suburban town with about 110 million in revenues, about 75 million of that comes from property taxes. They're a suburban town, which means there's not a lot of industry here. This is a fairly residential type town. 11 million of that $110 million budget, or 10%, is healthcare costs. We have about 14% renewals. That's $1.5 million of new costs there. They have a pension system that's underfunded, like most across the U.S. In their state, they are obligated to have their plan fully funded by 2040. They have an increasing amortization pension schedule. About $6.6 million appropriation, going to go up by about 8.6% a year. That's another $550,000. And their personnel costs are about 55% of the budget. That's going to go up by another 3%, or about another $2 million a year. So assuming everything else stays exactly flat, which we all know it will not, their costs went up by $4 million. So that's not great. Well, as I mentioned, this Proposition 2.5, state aid is pretty flat. So our property taxes are only allowed to go up by about $2.3 million. Therefore, we got a $1.7 million deficit before anything else happens. And again, that assumes that we have no inflation in the rest of the budget, which we know isn't true. So we have service cuts, those overrides I spoke about, asking taxpayers to pay more, which they generally say, no, thank you. And that's why we now have people asking about pension obligation bonds. Now, if you've heard me speak in other events, I'm not a big fan of pension obligation bonds, and we'll talk about those in a few minutes. Because they're generally a bad idea. If you remember the GFOA, Government Financial Officer Association, they generally consider them a poor practice. Now, they can make sense, so I'm not trying to say they're always a bad idea. They're just generally a bad idea when they're done. And we'll talk about that in a minute. And then Medicare Advantage plans have often been a time, hey, we could go and put in a Medicare Advantage plan to change my Medicare supplement plan. That can save me money, reduce my OPEB liability, and reduce my cash outlays. But again, that market right now is seeing a pullback, and that's going to create some problems there. So here's the sample budget. As an example, you see the property taxes go up by about $2.2 million. That's great. Local receipts are pretty flat. Earnings on investments is one people don't really talk about. Is the Fed has been cutting interest rates. A lot of municipalities have a lot of money in stable investments, checking accounts, CDs, short-term cash. Well, as the Fed cuts rates, guess what? Your earnings in short-term cash go down. This community state aid is pretty flat. They're using free cash or stabilization reserves into the budget, which is not ideal. Those are really meant for capital improvements and things like that. But alas, times are tough. They've been using it. They're trying to wean off of that and cut it from 7 million down to 5 million. Obviously, ideally, it would be zero. But here we are. So trying to do that, and then the other stuff is pretty flat. But we talked about their personnel went up by $1.8 million. The health insurance went up by $1.5 million. Pensions went up by $568,000. So to balance the budget, they got to cut $4 million out of a $32 million number, about 13.7%. That's just not doable. So again, the free cash probably will not get cut, but then there's still going to be layoffs and other things we have to do. That's just the reality of the budget, because the personnel is fixed under contract. The health insurance, it is what it is. The pension appropriations are by state law. So these aren't numbers that we can change. So this other is the only thing we really can change, the only lever we have. If we can't get more revenue, and if the residents have told us they're not going to give us more, this is where we are. So before we get into the Medicare Advantage for a second, just the question I see came in here is about OPEB. The numbers are huge. What do we do about them? The residents are complaining. The residents' numbers are high. What can we do to change these numbers? How can we fund our way out of the problem? And it's not easy because, again, as we talked about, the revenue isn't going up, so that part's out. Prescription drug benefits, we saw the GLP-1s and the like are adding to costs. OPEB is primarily a Medicare Advantage, a Medicare supplement area. Prescription drugs are really our main lever to try and cut it. So let's be honest, it's a benefit cut. So do we want to, reduce the formulary? Do we want to offer fewer drugs in the formulary, require more generics, take away some of the more experimental, if you will, or the more higher end drugs. You can do that, but it is a cut. There's also, you can also have employees pay more. The retirees can pay more in retirement for coverage. Many of them are already paying the max they can under law. So we have that. And again, we have other things. Can we find additional revenues? Some states allow maybe a meals tax. Other states might have, other things you tax, arena taxes, things like that. You could maybe dedicate those to OPEB. Again, it's not easy. And the sad part is it's not going to get any easier. So as hard as this seems today, I tell clients 10 years from now, you're going to look back and think these were the good days. So demographics and the like we'll talk about, things are not really going to make this any easier for you in the near term. So the Medicare Advantage plan. You guys have heard the what's your zip code, call now, Joe Namath, Jimmy Walker, and every former celebrity known to man is out there pitching Medicare Advantage plans. There's nothing inherently wrong with them. About 51% of retirees are in Medicare Advantage plans, so people are selecting them. And if you know what they are fine. The reality is they are an HMO that replaces Medicare. You have a narrower network. If you're in the Medicare and the Medicare supplement plans, you can go to any doctor you want across the US. They all take Medicare. Well, 99% of them take Medicare. You agree to a narrower network. That's what helps reduce costs. And therefore, they can offer you additional benefits. Well, the problem is the federal government's been cutting back the funding. I know it sounds great. Hey, they got a 4.3% increase. The problem is when medical care costs are up 10, 12, 15%. 4.3 is a cut. These carriers are pulling out of some markets. Vermont is down to 7 counties and only 1 carrier. But even, UHC, Humana, and Aetna are cutting back. But the reality is you're going to see fewer of the extras, maybe the dental, the vision, the other things that they were throwing in, the gym memberships, some higher deductibles. They'll probably tighten the networks a little bit more. So this is not going to be quite as attractive as it was. It's not going to be the easy exit ramp you had in the past. So pension obligation bonds, these came up before. So again, clients are starting to ask. And the reason is, let's be real. If you have a state where you are obligated to fund your pension plan under the law, and you go, I have to fund it over 10 years, 15 years, whatever, I can use a pension obligation bond and stretch out that period. Now, again, these are generally not a good idea. However, they can make sense. This is an arbitrage game. And to get into details about what that means, what I'm saying is, let's say right now your pension system has a 7% discount rate, so you're funding at a 7% assumed rate of return. If now you can go borrow money, say at 4%, 5%, and then you can invest the money and earn 7%, well, that ultimately that savings reduces your long-term costs. Sounds easy. Why wouldn't everybody do this? Well, here's the problem, or one of the problems. When you're borrowing this money, these pension obligation bonds are after-tax bonds. They don't get municipal bond tax-free treatment like your other bonds you issue are. Secondly, you're for a fixed debt. So once you issue this bond, you're going to get a debt to pay back that payment every single year at whatever interest rate you offer it. Secondly, the returns are not guaranteed. They weren't guaranteed in your pension system either, but here you've agreed to pay out a certain amount of money, and the only way this math works is if you can earn above and beyond that money. Now, here's the deal. Where these plans make sense is generally not when people buy them. So myself and one of the auditors that we work with were talking about pension obligation bonds during the height of COVID. When interest rates were down to near zero and the stock market was down by 30%, would have been a great time to issue a pension obligation bond because you're paying very little debt and the market has been punished, almost nowhere to go but up. What happens is interest rates get up to 5, 6%, and the stock market goes from 16,000 to 40,000 on the Dow. And now people go, we should issue a pension obligation bond. Well, the odds of you now exceeding your rate of return of that hurdle rate became far less, which is why the majority of pension obligation bonds underperform. So as I always tell clients, listen, if Goldman Sachs or Morgan Stanley or somebody's coming to you telling you you should issue a POB, odds are it's not a good idea for you. It's a great idea for them. They get paid whether it works out or not. So keep in mind, the other side of this is think about it like a hedge fund or Wall Street MBA crowd. They have a tough enough time timing the market. And so you guys think that you can naturally, I can just time the market. The odds are it's not going to work. Now, the reality is you're mainly doing it because you want to stretch the payment and fill short-term budget holes. So it's not a economic decision as much as it is a, I got to get to tomorrow decision. And so if that's what you have to do, that's what you have to do. In certain states, you require enabling legislation in order for you to issue a POB. Certain states, your town of X, you can just issue one any way you want. Many states require state legislature approval. If so, our argument would be is get the enabling legislation now. That doesn't mean issue a POB now. It simply gives you the opportunity if and when the market declines or interest rates come down, then you might find a market opportunity to do it. Again, generally, I'm not a fan. Generally, I don't think you or me, I'm not saying it's just you, any of us are smart enough to time the market. But again, at least give yourself a greater opportunity of winning on this arrangement. So the new S&P ratings model, and what's it all mean? It generally doesn't mean good thing if you're a municipality that carries debt. And if you have a large pension and OPEB plan, you carry a lot of debt. These are usually the number one and number two liabilities on your balance sheet if you offer those programs. So they took the debt component of their model from 10% to 20%, reduced the economy from 30% down to 20. So it doesn't seem like that big a deal. However, if you're a more generous benefit program, like a pension plan or an OPEB plan, you're one of those communities, you're going to look worse by comparison to your peers. So for those of you who have AAA bond ratings and you offer, a nice OPEB plan, you offer a rich pension plan, it's going to be very difficult to keep that AAA rating. Doesn't mean it's impossible. We had a client of ours who just got renewed last week and got their AAA rating. Good for them. On the other hand, we had another client who was doing everything right, who last year lost their AAA rating on this exact same model. So it's going to be very difficult to keep so. And again, if you're in one of the northeastern states or the midwestern states, these called the Rust Belt, for lack of a better, nicer way of saying it, the demographics are not your friend. And what I mean by that is we've seen total fertility rate in the U.S. go from about 1.9 in the mid 2000s down to about 1.6 today. Total replacement rate is 2.1. So if you're in one of these states that has a outmigration of population, this is not Texas or South Carolina or Florida where people are moving, you're going to end up with largely a smaller to flat population that is going to be older with fewer children in the school system. That generally puts pressure on the revenue side of your budget. These long-term legacy costs are still there. That's going to make the financial performance elements of that ratings model difficult in addition to this higher debt factor. So again, this is why for those kind of communities, keeping AAA is going to be difficult, and why it's just important is forever to continue funding and knocking out this debt. So again, as I said before, 10 years from now, you're going to look back and think, oh boy, things were so easy back in 2025. You just need to keep powering through that debt as hard as it is now, because it's only going to get harder later. So employee classification depends on what state you're in and what your pension plan is and things like that. In general, public safety employees tend to retire earlier and have different mortality and employment patterns. And the reason why this is important is if you have an OPEB plan or a pension plan for that matter, these people are going to have a longer period in retirement. Therefore, they accrue their benefit over a shorter period of time. And on the OPEB side, as you probably know, your benefits are not based on pay, but they're based on age more than anything. And in many states, the contributions that the retirees pay are not based on when they retire or what years of service they had. So as I give the example, like a 55-year-old police chief who retires with a 35-year-old spouse and a couple of children will likely have an OPEB liability at retirement of well over $1 million. So that's not a small number. Now, that same person who was a general government employee who retired at 65 might have a liability with their spouse of maybe $250,000. So it's a very different item. And the other one, for those who have enterprise, we call them light departments, gas departments, water departments, and so on. Many of those folks also have similar mortality and demographic patterns as public safety. And I know it's easy for those of us who don't work in those spaces to go, oh, they're light department. They all work in an office. Remember, there's people up there on the lines. Those are dangerous jobs, and they have, things that go with that. They retire earlier because, some 60-year-olds can do everything. I'm not meaning to diminish 60-year-olds. I am one of those people. But however, many of them don't want to be getting up on those cranes and those ladders and doing those things when they're 60, 70 years old. That, to quote some people, that's a young man's game. So again, keep that in mind. Another big issue we see is retirees over the age of 65 remain on active health plans. They're not in a Medicare supplement plan. And you go, what do I care? A premium's a premium. Well, if you have an OPEB plan, you care. And I say it for this reason. We have to factor in the cost, the expected cost by age of what healthcare costs are going to be. Your healthcare costs, you're 85 years old, are maybe about $35,000 a year. If you're on Medicare, Medicare is going to pay about $27,000, $28,000 of those costs, and your Medicare supplement will pay the balance. If you're not on Medicare, your plan is going to pay that $35,000. So the question is, do you want Medicare to pay that 75 to 80% or not? And you say, well, I just pay the insurance company X. What do I care? The reality is, from an OPEB perspective and an actuarial standards perspective, we are obligated under the rules of our professional designations to factor in the real cost, not what the insurance company charges you. So there's a subsidy from the younger active employees who are subsidizing the premium that is actually paid by the 85-year-old retiree. Then you go, well, then why wouldn't people be in Medicare if they're 85 years old? Well, teachers who were hired before March 31st of 1986 were never obligated to pay in the Medicare. The rules changed in 1986, but they were grandfathered in. So many of those people have never paid in. There are a few public safety people, maybe it's a teacher issue. So the question is, they've never paid in. What can I do? Well, you can do what's called a Medicare buy-in. And I see a question here about how to do that, and I'll explain that in a second. So a Medicare buy-in is basically going, I go to the CMS, Center for Medicare Services, and I say, hey, listen, I've got this list of retirees who've never paid in the Medicare. They're not eligible. I want to make them eligible. Well, to do that, you have to pay a premium, Medicare Part A, and you have to pay a Medicare Part B penalty. So if they're going to pay their Medicare Part B on their own, that part's fine. But there's a penalty associated with the fact they didn't enroll at 65. They enrolled at 70 now, 75, 85, whatever it is. Now, then you go, well, shouldn't I do this then? It's a great idea. Well, it is if, and it's a big if you're the one who's going to see the resulting savings. So if you're part of a regional purchasing cooperative, let's say, you and 10 towns get together to purchase insurance, and you guys pool all of your experience. Well, if I take all these expensive 85-year-olds and I turn them into much less expensive 85-year-olds, the reality is the whole pool benefits and not just me. So if it's not going to impact my rates exactly, specifically, it probably doesn't make sense to do it. Now, if I have my own pool, I'm self-insured, or if I'm fully insured by myself, it's a phenomenal deal to do. Because again, even if I'm going to pay these rather large premiums to Medicare, it's probably going to be about $600 a month on the Part A and maybe another $100 a month on the Medicare Part B penalty. At $700 a month or about $8,500 a year, well, as I said before, I had $35,000 of costs my plan was paying. Now it's going to come down to 7 or 8. So I can get $26,000, $27,000 a year of savings, and it's going to cost me $8,000 a year to do it. From a cash standpoint, that's phenomenal. From an OPEB liability standpoint, that's also phenomenal. So again, really something you should look at doing. And again, as the question was, how do I go about doing that? Again, it starts with contacting CMS, giving them that list of people. They'll tell you what the numbers are, and then you have to decide whether or not it makes sense. Talk to your healthcare consultant to see if this is something you want to do. So again, you want to hire people with prior retirement service. Now, this depends on your state and your situation. So like in certain states, each retirement system stands alone. If I go from town of X to town of Y, my service doesn't transfer. I leave my benefit at the old town, and away I go. In certain states, your liability transfers with you. And so what happens there is I might go from town of X to town of Y. I have 10 years of service. My 10 years of service carries over to the new town, and there's basically money that follows with me from system 1 to system 2. Sounds great. No problem. The liability, I pay for my liability on the way in the door. Nobody gets penalized by it. On the other hand, on the OPEB side, if we're going to allow that transfer of service, what happens is I now walk into the second system. I'm already eligible to retire on day 1. So, as I talked about, for a 65-year-old retiree, maybe have 75-25 cost sharing. That's about a $95,000 liability. So I can come here and I can work for a year and take a $95,000 liability, and maybe I have a spouse. He or she might be a couple years younger for $145,000. That's $240,000 of liability I took on to hire this person. And then you say, okay, that would never happen. Well, I can tell you during COVID, as an example, we had a town that hired a teacher during COVID. She was about 63 years old. She came and worked for a year and left. And she had a spouse, and we got that $250,000 liability that she took with her on the way out the door. So I'm not saying or encouraging age discrimination of any kind. Let's be clear. However, keep in mind when you hire that person with a lot of prior service, if your system allows them to carry that service from one system to another, you're taking on the chance to take a very large OPEB liability. So just keep that in mind. So here are the issues many of you know, prior retirement service. What are the factors incur all these accrued liabilities? We've got age. How old are they? Older people have higher liabilities than younger people. Prior service. If I come in with 10 years of service versus 20, I'm going to have less liability than the one with 20 years. How many years of service do I have at retirement? And I back to the slide. The cost sharing. If I require the retirees to pay 50% of their costs, less than I will require them to pay 25%. Do they have a spouse? And if so, what's the age of the spouse? Are they going to be eligible at Medicare? And what's the discount rate? So all these factors factor into it. So there's a lot of things going on here. So the migration from the private sector to the public sector. So here's the thing. Years ago, about 30 plus years ago at this point, in the private sector, we had a lot of OPEB plans. People like me, actuaries, we went out to our clients and said, who asked, what can I do about these costs? I don't want to put this on my balance sheet. What can I do? And we talked about changes in contributions, changes in retirement eligibility. We talked about varying contributions by age, things like that. A lot of different things we could do. Medicare Advantage plans and the like. Or we said, hell, you can even just get rid of your OPEB plan altogether to send out a memo. Next day, the memo goes out, problem's gone, plan is gone, issue solved. The problem now is, 30 years later, a lot of these people are now retiring. And they don't have OPEB plans where they retire from, but their spouse works in the public sector. Isn't that great? Well, if my spouse works in the public sector, I can go on their plan at retirement. We might have been on my plan while I actively worked because maybe I had better cost sharing. My employer paid 90% of the costs in the private sector. Come over to my plan. But now it's time to retire. Let's go over to the public sector plan because maybe it might be a 50-50 plan, but it's still health insurance and somebody's paying half the cost for. And to use the, the public sector marketplaces is not as good as deal as this is going to be. So let's come on over here. So what can I as a public sector employer do to reduce my risk or my exposure? You might want to think about you have to make a one-time election. So in other words, you're going to retire, you cover your spouse now, or you never get to cover them. So now the downside of that is they might cover a spouse they might have not have otherwise covered simply because they didn't want to take a chance of later. That's certainly true. On the other hand, if that's the case, they're probably coming anyway. The other issue is people retire and maybe they get divorced later on and they want to, bring in the new spouse. You say, no, the only spouse we cover is the one you were married to at the date you retired. Now, again, that may seem harsh because maybe people die and they get remarried and they want to cover that new spouse. That's all true. That's an HR issue, not a financial issue. So if you ask me, how do we cut these costs? That's one way to do it. But again, this is something you have to deal with. And again, I would argue this is probably likely to increase even more over time as private sector plans continue. Those who are left, even those will continue to disappear. So Medicare Part B reimbursement, again, not a real common thing. We do have plenty of OPEB plans. I'd say maybe 10 to 15% of them do reimburse some or all of retirees' Medicare Part B costs. That's becoming less common now. Again, those who do it, they probably reimburse about half of that cost. But we're seeing towns come to us now and go, is there some way we can cut this cost? Can we reduce it? Can we cut the cost? Can we eliminate it? So you're probably going to see grandfathered groups. And this is an example. If you do that, you can say, I'm going to grandfather everybody who maybe retired before July 1st of 2025, let's say. If that's the case, when you're dealing with your actuary, it'll be very important to give them a proper retirement date, because without that, they're going to assume that everybody gets this benefit, when in reality, it's only people hired or retired before a certain date, depending on how you do your grandfather group. That data will become very important. So this is an issue, depending on your state. Again, this is related to the state of Massachusetts. Other states may have something similar. The issue is your pension system, assuming it gets to 100% funded, and that's always a bit of a big if, but let's assume it is going to get to 100% funded. Is that really the goal? So in the state of Massachusetts, for example, they have a rule that says systems must be 100% funded by the year 2040. Their governing authority is really encouraging people to go beyond 100% funded. Think about 110 to 115%. Now, a lot of these towns, we talked about the tight budgets, we're hoping, hey, we're 5, 6, 10 years away from getting to 100% funded. There's going to be some money freed up. We saw those pension appropriations increasing by 8.6%. They saw some light at the end of the rainbow. They were finally going to get there. The future was going to look bright. And now we're saying, well, just wait a little bit longer. Well, the problem is what a lot of them were doing is planning on using this pension savings and using it to fund their OPEB. So now that's going to mean that money's not available for another 4 to 5 years. The downside of this is that's going to cause a downward pressure on their discount rates, means liabilities go up. We talked before about S&P looking at debt. Discount rates go down, liabilities go up. So now we have more debt on our balance sheet. The reality is that overfunding in the pension system, that's not going to show as an asset on the balance sheet. You don't get credit for an asset, you only get credit for liabilities. So this is going to be a negative on bond ratings in the near term, let's put it that way. And again, a lot of these towns were hoping, praying for use of this money, and now it's going to be a little bit more delayed. So again, we talked about it in the state of Massachusetts. We've got a 2040 rule. Many systems will be fully funded. And again, if you're not in Massachusetts, you probably don't care about this. But again, this is going to be, extend out the period in which you had to wait for your money. So another thing we've seen is this thing called a hybrid model. There's a firm out there called PARS, Public Administrative Retirement Systems. They happen to offer a pension smoothing fund. Basically, the idea is you put $10 million a year into your fund. Your pension obligations under your law might be $7, $8, $9 million, whatever it is. You pay that bill out of that same fund, and whatever is left, you can now either leave in there to stabilize future contributions and or send over to OPEB. So it's a combined fund to fund both OPEB and pensions. It allows you to stabilize, like a shock absorber, if you will. If you get hit with a big pension appropriation in a given year, you've got some money set aside. So it's really a shock absorber. And again, this is not for everybody. PARS, I'm not endorsing. They happen to offer this product. Other people probably will in the future. But again, it's a nice product to enable you to get money, because a lot of your municipalities, if money stays in municipal funds, has to be invested really at stable value type rates. We're talking 3, 4, 5%, very short-term debt. This enables them now to put it into a 115 trust, an IRS Section 115 trust, where it can be invested in equities, longer-term instruments with expected higher rates of return. So again, not saying you should or shouldn't do this, is your call, but again, something to keep in mind. And again, that's really what I've got. One of the questions that did come up I see here is, are we going to adjust healthcare cost inflation assumptions? And the answer to that is yes in the short term. I know we've, like a lot of people, have had a model that graded down to about a 5% expected healthcare cost over the long term. But here we are in the near term. We expect rates to spike up, so we're going to spike our rates up and come back down again over time. That will increase OPEB liabilities, let's be honest, but the liabilities are going to be higher anyway. Healthcare costs are going to be what they're going to be, regardless of what your actuary assumes. So keep that in mind. These are not all of a sudden, hey, Parker and Odyssey decided we wanted to increase costs. I had nothing to do with what your healthcare costs are. So keep that in mind. Again, I know there's a lot of stuff going on here. I've given my contact information here. If questions arise, reach out. I know there's a lot of stuff. You can talk to your actuary. You can talk to us. Talk to your finance professionals, your investment team. There's a lot going on. Municipal budgets are tough. They're not getting any easier. I wish I had good answers for you. But again, the demography, if you're in one of these Rust Belt or northeastern states, it's only going to get harder from here. We have an aging population. We have a shrinking population. So it's important now more than ever to really do what you can on these numbers. Healthcare costs, do what you can, decrease them. See what you can do to, supply funding. Find alternative sources of revenue if you can. Talk to your legislators about giving you more flexibility and remove some of the unfunded mandates. Because again, there's only one way out of this, and the revenue is going to be the hardest thing, because your residents are not going to really necessarily offer up more revenue. So it's really going to be on the cost side more than anything. And that's the hardest thing to change, as we all know. With that, I wish you well. Thank you again for attending. And again, if you have questions, certainly reach out. Thank you again for your time.